Hey everyone, it's Dr. Jordan Cossin here again with PhysioU, and today's Mentoring Minutes is actually going to be about the upper quarter wide balance test. Now, all of us are pretty familiar using it for the lower extremities with regard to injury prevention, but also risk assessment. There's a lot of good research that shows we can do the same for the upper extremity. Hazar and colleagues actually posted a really good article regarding, if there was a difference, if they can determine a difference between individuals with shoulder impingement syndrome and then the healthy normative controls. And what they did find is that actually using the wide balance test, you can determine a difference between individuals with shoulder impingement syndrome and those without. So the ones with shoulder impingement syndrome perform significantly less well on this particular exam. The other thing is that athletes actually performed significantly better as well on this versus untrained. There's a lot of good research that shows that this is actually has excellent retest reliability and fair to moderate correlation with upper quarter stability, but also upper extremity functional tests too, like the closed kinetic chain upper extremity test, a push-up test, but also a side plank. So it's a valid and useful test to actually be using for your upper extremity patients. What was interesting though is that there's some research they were trying to compare dominant and non-dominant, and there was really no difference there. But with this, it's a very useful tool to actually go ahead and determine whether or not your athletes are ready for maybe return to sport, or if you're just rehabbing an individual with shoulder pain themselves. So now that we've talked about the wide balance test for the upper extremities, let's actually go through how to do it. The first thing you're going to want to do is actually measure the arm length, so that way you can use it in your calculations later. How you're going to do that is, we'll have Chris abduct his arm to 90 degrees. You're going to take the measurement from the C7 spinous process to the length of the longest digit and keep that in your documentation. From there, the next thing is actually getting into a push-up position. So with the ulnar side of the hand to be tested, it's going to be on this center line here. From there, Chris is going to assume a push-up position with his feet about 12 inches apart. Now typically you'll do 3 practice trials and then 3 data collection trials for both sides. Right now we'll focus on just his left. At this point, you're just going to have them move the boxes. So Chris, can you push this box here as far as you can go out? Good. Same thing with this top one here. And then reach underneath for that next one there. Perfect. You can go ahead and stand on up. So he is pushing in the medial direction, the superolateral direction, and the inferolateral direction as well. At this point, you can actually take a measurement from that center point where the ulnar side of his hand was to the box itself. Another way that you can do this is actually Kramer et al. Came up with, they did a study based on, they used the actual wide balance test apparatus, and they compared it to one that they made on their own. They used 3 cloth tape measures. They used athletic tape for this center line here. They also used a goni. This should be about 90 degrees of angle here and about 135 degrees of angle here. And then also they used wood blocks for the actual pushing out. And then they used the measurements there. And what they found was that they actually had a pretty good correlation between the two. So if it's more of an issue of the price of the wide balance test, you can actually go ahead and make your own here and have pretty good results with it as well. To wrap things up, the upper quarter wide balance test it's a reliable test, but it's also, you can discern between individuals with pathologies in the shoulder, like shoulder impingement itself, and healthy norms. So it's something that we can definitely be taking a look at with our upper extremity patients. Be sure to take a look at the notes at the bottom of this video for a little bit more instruction on how to perform this, but also for the calculations that you'll be using. Thanks again for joining us today with Mentoring Minutes. Don't forget to take a look and follow us on social media, but also taking a look at the Knowledge Central portion of our PhysioU.health for any other information that you could be needing.